Hello. Good evening. Good evening, everyone. Hope everyone's having a good Wednesday. Thank you all for taking the time to be with us tonight for our webinar on experience from inside hospital, what happened during COVID-19 treatment. Today, we are fortunate to have speakers from many sides of the spectrum, from an expat with first-hand COVID-19 experience to a senior executive from one of the largest hospital group in Thailand and also many parts of Asia. And of course, Luma on the health insurance side. To start off, we have Dr. Gerard Lalonde, Luma's Chief Medical Officer, who will begin representing the current situation of COVID-19 in Thailand and highlight the management of care implemented by Thai infectious disease specialists. Next up, we have Shong Shal, an expatriate living in Thailand and also a Luma member. Mr. Shong Shal will talk about his own experience as a COVID-19 patient admitted at a Thai public hospital. Following Mr. Shong Shal's talk, we have Mr. Nicola Lulu, a senior executive from Simitivate Hospital Group in Bangkok. Nicola will share his insider accounts on private hospitals and how they are prepared to handle COVID-19 patients in their facilities. To conclude, Mr. Guillaume de Fromont, Luma's channel manager, will explain the different health insurance product options available which offers COVID-19 coverage. During the talks, please feel free to ask questions by sending it via the chat tool of Zoom. The speaker will answer as many questions as we can, time permitting. And after each talk, we'll answer those questions. Any remaining questions we'll answer at the end of the talk. So without further ado, I would like to thank all our speakers and participants again for joining this webinar and for being with us tonight. I will now give the floor to Dr. Gerard.
Bonjour et bienvenue à tous. Good afternoon and thank you to be part of this webinar with Luma. So I will present 3 points as an overview of COVID-19 in Thailand, starting with the current situation of the COVID-19 epidemiologic curve. Then I will discuss the management of care in Thailand. There were many questions on that from both local and also a lot of expatriates. And the third is hospital capacity to handle the crisis, which is also a common question among people here. Next. So on this slide, you can see on the left side, the shape of the curve during the SARS epidemics, which happened late 2002 until about June 2003. So you see what we call a typical exponential curve called Gauss curve, which shows a rapid increase in number of cases. Then it reached a peak, a plateau, and then a sharp decrease in number of cases. On the right side of the slide, you see what is happening now in Thailand as of 21 April. You see roughly the same shape. Sharp increase. Okay, there was in March 22 some kind of unexpected peak, probably because there was no report of these people earlier. And then a plateau, and then a slight decrease. Not so rapid, but constant decrease of the new cases, with now only very few cases in Thailand as of today. Next slide. This shows, next slide please. Yeah. This shows also the current situation of epidemiologic curves in other countries. And you can see is roughly the same shape. In Japan, rise, then plateau, and then decrease. The Philippines, same story, there is now a decline, which is quite obvious. USA has reached a very high peak and still maintain a long phase of plateau, but we can see some sign of declining. Same in France and same in Italy, which is a very clear decrease in the case. So all these countries are seeing already the peak behind and already on the declining stage. The example of Singapore is a bit different because they simply forgot to take care of migrants workers. And there was a kind of big cluster which happened recently. So that's why you see a big peak, which was not supposed to come. But I think Singapore has the ability to handle this additional number of new cases. Next slide, please. Management of care. At the beginning of the epidemics, Thailand decided only to bring COVID-19 positive patients to accredited hospital, dedicated hospital which have the ability to treat highly infectious patients. So they were first transferred to Pamran Naradun, which is in Nonthaburi, which is the #1 hospital when it comes to epidemics, and also in the center of Bangkok, the Rajviti Hospital, which is a teaching hospital. Later on, they added 2 more hospitals, the Nakhon Pathom Hospital and also Maharaj Chiang Mai Hospital in the north of the country. In the mid of March, with a number of cases which started to increase, the government asked the private hospitals to also share and contribute to managing these epidemics. Nicolas will talk also about this aspect here and how the hospitals were prepared to handle these cases. But what I know, they set up very quickly a committee to handle these COVID-19 specific patients with senior management, infectious disease specialists, and they were prepared before they were asked to take care of these patients. In terms of testing and therapeutic protocols, testing is a bit complicated. It was a long debated subject because, as you know, some countries have organized massive testing, such as South Korea, Taiwan, even Italy also, while others, like France, have been very few, and in Thailand, relatively selected testing to people who were at serious risk to contract the disease. The therapeutic protocols is important to know is updated on a regular basis. On a regular basis because they use a huge amount of clinical studies and studies done on COVID-19. I looked this afternoon, there are 5,600 scientific papers already published on COVID-19, which is amazing. And this brings new lights about how to treat more effectively this disease. So every 2 weeks, the government updates the hospital, both private and public, to manage COVID-19 patients. So whether you are treated in public hospital or in private, you are likely to receive the same protocol. Of course, there are some differences which is linked to the background of the patient, the intensity and duration of the symptoms, the comorbidities, and of course there is the judgment of the doctor to whether give this regimen or this other regimen. But in general, most of the people who receive hydroxychloroquine as a first-line agent, plus a combination of 2 antiretroviral agents which are used for HIV infection. And they may also receive azithromycin, which is one of the very common antibiotics used for respiratory disease. They may also use one of the latest antiviral used in Japan, which is called Faviparivir. I think his name also during his presentation. So again, it will depend on the symptoms, it depend also on the result of the chest X-ray or the CT scan to adjust the treatment. But as a whole, without entering too much in details, because Jean-Charles will talk about his experience, most of the people who tested positive were treated in both private and public hospital, and we have some experience with the LUMA members. They reported a rather positive experience in the sense that they found professional staff, well organized, also following a very clear process also. And they have the general feeling that these doctors were confident in handling their cases and to treat them. Next slide. So hospital capacity to handle COVID-19, this is the last slide. As you know, the situation is improving in Thailand. And we know that Thailand has been also acclaimed as one of the medical hubs in Southeast Asia and even in Asia. As you know, there are quite a lot of teaching hospitals in the country. Regional hospitals in the main province are also equipped with intensive care units. And there is also a very strong private hospital network here, especially with BDMS group, which alone has 44 hospitals each of them being accredited with the GCI accreditation, which means they know how to manage infectious disease, and they have all ICU units also in all hospitals. So in terms of handling the crisis here, the facilities, and especially with the controlled number of cases, I think it's no longer a question that Thailand can handle this crisis. Last but not the least is the confidence among the medical profession. I had the chance to meet a lot of friends and colleagues, which are internists, infectious disease specialists, but also other specialties, including also directors of hospital. And all of them show, I must say, quite strong confidence about treating the patients and handling these epidemics. I must say that the Thai have also a long experience. They've been managing the SARS, the bird flu, a few years later, the MERS syndrome, the H1N1 in 2009. So they have acquired a good experience in managing this kind of outbreaks. Just to finish, I will just put this in perspective. The total deaths of COVID-19 up to today is 49 people. Is, of course, a high number when considering that these people should not have died. But if you compare with the number of deaths which happen every day on the traffic, on the road of Thailand, is the same. About 45 to 50 people dying on the road in normal condition in Thailand, which is what COVID-19 led about the same number, 49, in 3.5 months of epidemic outbreak. So this to put in perspective that we should remain serene and also confident about how the country is and has been managed the crisis here. Thank you.
Thank you very much, Dr. Gerard, for your talk. I think we have time for just one question. So I'm going to ask one, which is a frequently asked question. So from Miss Josian, I heard the virus does not survive in hot weather. What do you know?
Can you repeat the question?
I heard that the virus does not survive in hot weather. What do you know?
In warm weather?
Yes, yes. The virus does not survive in hot weather. Yeah. What are your thoughts on that, Dr.
This epidemic looks like a seasonal viral respiratory disease, obviously. And it's true that when you look at influenza, which is flu, influenza coldis means influenced by cold. And most of the epidemics of flu happen during winter in the Western Hemisphere. But it doesn't mean that flu cannot happen in tropical countries also. But there is probably, and more than that, highly possible that the influence of weather has an impact on this. If you look retrospectively in Wuhan, the decrease in the cases happened when the temperature started to rise above 15 degrees. I was following this very carefully, and I found that when the climate, the temperature were about 0 to 10, there were still a lot of cases. And then when it reached 15 to 20, then the plateau was reached and it was already a decrease. But it's too simple to say that the hot weather protects against this, but that can be also a factor.
Okay, thank you. I think we have one more time for another question. So another question is, where is the source of truth to see the daily numbers of people who get tested in Thailand and in other countries?
What is the meaning of the question?
So I think what the participant would like to know is which source can you refer to see the daily number of people that are getting tested in Thailand and in other countries? Whether there is a source of information that is reliable, that the public can see?
Most of the countries in the world have some kind of dealing with the WHO and are supposed to report in a transparent manner the number of cases which are confirmed positive. Most of them also used same PCR polymerase chain reaction test to diagnose the presence of virus in the different testing which is done. this is transparent, and you have the world odometer, which shows all this curve, which I show. I believe that most of the countries have been transparent. Of course, there can be some figures which might not be exactly correct because it may not be reported. Some people may be misdiagnosed. Some people may not be tested and just simply go home positive, and then the disease just resolved by itself. We know that 80% of the people infected with COVID-19 do not need any treatment. So for this test, I think in the number of positive cases, you can rely on what the WHO is providing, and first of all, to the CDC of the Thai Ministry of Public Health. Welcome.
Thank you, Gerard, for your answer. Actually, thank you to all the participants. We have, I think, over 10 questions right now, but given the time, we'll have to move on to Mr. Jean-Charles, and we'll try to answer as best as we can the remaining questions at the end of the webinar. So, Jean-Charles, I pass the microphone to you.
Hello, everybody. Can you hear me well? Yes. Okay, so my name is Jean-Charles. I'm an expatriate in Bangkok for about 10 years, and I'm going to explain you the past months, my experience being sick on COVID-19 and my recovery. I will focus essentially on the interaction with the medical staff, my room and my onboarding experience at the hospital, and my communication with outside and my relatives. Can you go to the next slide, please? Okay, so to be brief, since January, like most of us, I have been aware that there is a virus around, so we took a lot of precautions, like to use the gels, the mask, trying to protect myself and clean my hands as much as possible, until the point that I was still going at the office until the 21st of March, until the date that they closed my office on the 20th. And I told myself, okay, let's go for a last meeting with friends on 21 before staying at home for the next 30 days. And that's the same day that I think I caught the disease in Bangkok, because 3 days later, I started to feel some fevers. I went to sauna and felt a bit better, but then I felt a bit of coughing and I was not feeling well. And 2 days later, my wife started to have the same symptoms. And I heard on the next Wednesday as well that my friend I met at this event at his house also had the big fever and was sick. And so actually he went first for a COVID test at the hospital. He went to Sanitivej, and then I waited at home. My wife's symptoms were not getting good. And on Saturday 28th, when we woke up, my friends told me that he was positive. So we rushed to the hospital and went to Chula Longkorn Hospital, which is a public hospital, where we could get tested within an hour for 3,750 baht. And the staff was protected by windows, and the protocol was really in place. So we had to test by nose, by mouth, and by X-ray chest. The results of the X-ray test were given automatically, and they found out that my wife's results were not clean. So they asked her to stay right now. She couldn't go back to home. But they let me go back home and told me that within 24 hours, they will tell me if I have to come back to the hospital in case my test is positive. So I went back home. Next morning, I woke up at 10. The doctors called me and said, look, you have to come right now to the hospital. You are positive and you can board on the same room as your wife. We're going to start the treatment. So I went directly to the hospital, picking some clothes and a bit of stuff at my place. But of course, I was a bit on rush, so I forgot a lot of things. At the hospital, we joined the room, and then I started to have, I didn't meet my doctor face-to-face during the whole process. We could talk to the doctor once a day by phone. And the first people I met were nurses who came to take my blood and who came to do more tests from the urine. And they took us on the blood pressure, and they gave us some accessories to take our temperatures every 4 hours and our oxygen and blood pressure every 4 hours. So we had to report these numbers progressively, and we started the medicines that the Dr. Gerard just mentioned before. So we had to take medicines morning, lunch, and dinner. and report our conditions on the phone every 4 hours. So you have to understand that we never met our actual doctor face to face. We have to follow the clauses of the hospital and the food as well. So of course, as being a public hospital, you have to understand they don't speak as good English as in the private hospitals. However, the doctor was speaking English and they helped with my wife for the conversation and giving us the instructions on how to get cured. The symptoms took about 4 days. And after 4 days, our fevers went down and we didn't have much more issue except being quite tired from the virus. The biggest symptoms that I felt just before boarding from the hospital that also made me worry is the loss of the taste and the loss of the smell. You cannot differentiate a tablet of chocolate and a tomato. Your mouth becomes completely off of sense and the sense for your smell. So if you start to feel these symptoms, I think it's a good clue to know if you have the virus or not, even if you don't cough too much or have too much fever. And this took maybe 2.5 weeks, about 3 weeks to come back to a normal level, which is now. So I spent at the hospital, like you can see, 4 days from Saturday to Thursday. And then we had to leave to an hotel, which is owned by the government, to stay in quarantine and keep the medicines on. We had no rights of visit at the hospital and no food delivery. You have to understand that the floor was locked by a key and there was also no Wi-Fi, but we could rely on our mobile data. And I also took an even dose, so I could have a bit of reading and a bit of gaming waiting at the hospital. Next slide, please. So then after these 4 days of treatment, they found our let's say our KPIs to be clean. So they told us, look, we need to empty the rooms because there are more patients coming. So they took us by a van full of plastic and brought us to an hotel. And we had to stay 7 days in a small room. So the room was more comfortable in terms of bed and facilities. But the thing is that we couldn't go outside and we didn't have much space for walking. Only friends could bring things before 6 p.m. and it had to be served only at 6 p.m. and they didn't accept food delivery, so the food was a bit better, but not yet the best. And I would say that at the beginning we were quite happy to go out from the hospital, so the feel of this new room was good, but the no cleaning and the dust after 7 days started to be a bit irritating compared to being at home on quarantine. It's also impossible to walk outside of the room, and they try to keep you in these hotels because they have direct access to nurses and to the medical department. So in case your conditions would fall back to a bad stage, then they can drive you directly back to the hospital from this hotel. So why the quarantine in this place? Then after 7 days, we could go back home, and now it has been 2 weeks since we are back home. My quarantine is luckily over today, so I can consider myself cured. I don't have any more symptoms or bad effects from the disease. Our buildings have cleaned our unit. The building staff has been friendly and understandable compared to some stories sometimes you hear online. And we can get delivery, do some exercise at our floor, resume sport and good food that we can cook our own. On 28, my wife has to go back for an X-ray because she was the only one of us who had this not clean position. And if I would like to conclude on the experience, I think overall, even if it was stressful and hard to get to understand all the process from the hospital at the beginning, because many laws changed while we were at the hospital on how long they would keep us, how long they would put us in the hospital hotel. I think we received a good treatment. It was fast, efficient. The tests were available. There was no big queue at the hospital. So the cure can happen in Thailand. We are back home and now healthy. My quarantine is over today, so ready to go back to a normal life. I mean, normal for the first steps, and ready to see the world open. And luckily, Luma has been helping us by calling us, and Dr. Gerard as well during our stay at the hospital. And I felt that we had a good communication overall with the team. So thank you so much.
Thank you very much, Jean-Charles, for sharing your experience. I think it's definitely, even with excellent care, it's not a very pleasant one. We have a few questions. One of them is, after you were discharged, do you need to take any further medicine?
On my case, my treatment was over during the time I was at the hotel for 7 days. but my wife still had a little bit of medicine back home here for the cough. So the dextromethorgan, the last medicine which is about the cough, yeah. But for me, nothing else, no more.
Okay.
So the treatment was about, my treatment was about 8 days. And let's say the strong medicines were given a lot during the first days, and then they reduced the quantity over the time.
Okay. And we have another question. Can you repeat again what your initial symptoms were?
So again, I felt very tired. I had a little bit of fever. Then my cough was dry, but not very, just a few times per day. And the worst feeling I had was to feel something in my throat, and the complete loss of smell and the complete loss of the taste.
And was that the same for your wife?
Yes, she had the same, but for her the fever was higher and the cough was much higher.
And
that's why they found out she started to have a pneumonia at the hospital, and they kept her directly. She couldn't go back home. So as a last advice, I forgot to talk about this, but I advise people, if you have to go for a test and you feel sick, don't remember to bring your own things, bring your clothes, bring your books, because if your condition is not good, they will not let you go back home to take your things before being admitted at the hospital.
Thank you, Jean-Charles. That's a great tip. Thank you again, and we will reserve the remaining questions for the end of the webinar. So I'll now pass the floor to Mr. Nicolas Leloup from Semi-Tibet Hospital. Thank you, Jean-Charles again. Nicolas, you may start. Thank you.
Thank you, Vic. Good evening, everybody. Thank you to Luma team for arranging this seminar and inviting me. So I've been asked to talk about how private hospitals can help in these times. So my presentation will talk, it's applicable for all major private hospitals, I would imagine, but of course I will speak specifically about Semi-Tibet. Next slide. So here is actually an overview of how we approach the management of care for COVID patients. The first thing you need to know is that actually we set up an infectious control committee. This committee is actually kind of a task force to adjust the hospital operations to the flow of patients from COVID and the protocols. So that committee is headed by Dr. Onuma, our leading infectiologist, and there are other infectious disease specialists, other doctors from other specialties, and then the quality department. So it's all medical actually, and they are instructing the hospitals how to set up, how to change the patient flow, and what the treatment protocol should be. We got our information first from the WHO, and actually it makes sense because the WHO has a global footprint. So they have offices in most countries, including China, and they were the first one to have access to information and feedback from the medical community. So they were the first one to actually give information and share information to the scientific community. Now we in the fourth month of the crisis, so we're dealing mostly with the DDC, which is a Department of Disease Control. It belongs to the Ministry of Health. And actually they are the ones giving out the treatment recommendations, the treatment protocols, the clinical practice guidelines, and also the overall policies and restrictions, especially when it comes to self-isolations and quarantine. So we have to respect that. So the way we do that is by looking at three main items, which is basically screening and then isolation and then treatment. So for screening, we obviously at all the entrances, we now screen your temperature, give you hand gels and sanitizers. No, previous slides, thank you. And so we will screen anybody that comes into the hospital premises. But we also had to set up the RE clinic. So RE stands for acute respiratory infection. And so those clinics are set up in most hospitals, and they are screening zones outside of the main facilities. So I will show you where they are at Summit a bit later, but they are basically tents outside of the hospitals where you can have those patients. We also have a fast track service, and this is basically a drive-through, and then the ER when it's out of office hours. So the way we do the tests is for a PUI, means patient under investigation. So for people without symptoms, we will advise you to go through the fast track. So you can do it in your car, we'll do the swab, and then we will send you the test results within 2 days at most. While you're waiting for the test results, you are being asked to stay at home and self-isolate. If you're already symptomatic, we will send you to the ARI clinic, where actually the precaution and the personal protective equipment from the doctor is more impressive, and we'll do the test there. And we will keep you in the hospital until we get the results, which again takes 24 to 48 hours. So for the isolation, so like I mentioned, you can do it at home, or we have negative pressure rooms, so that's for the extreme cases, and we have an intermediate zone for patients to stay, and then we have cohort ward where all the COVID patients will stay. So self-isolations, that's for the patients with no to moderate symptoms, actually, so, and low-risk patients. But the government asks us to make sure that the accommodation is self-isolation ready. So that's a bit of a gray area, but basically if you live in a condo and you are likely to have exposure to other people, the government has instructed us to keep the patients in-house. So that's, but if you live in a house and the isolations can be respected, then, like you can go home and wait there and have a conversation with your doctor. Inside the hospital is for symptomatic patients and high-risk patients. Those high-risk patients are elderly patients, patients with diabetes history, cardiac history, or other pneumonia infections. So if you have comorbidities targeting your respiratory systems, then you're most likely going to stay home. So that's how we do the isolation. And then for treatment, then you'll be transferred to cohort wards. So these are basically standard wards that we isolate and we close and we reserve only for COVID patients. And basically only medical personnel with personal protective equipment is allowed to enter those wards. So no family visits. And then for the extreme cases is ICU. Again, for the treatment protocol, we follow the DDC guidelines and also the infectious disease specialist recommendation. So there is a little bit of room for maneuvering there from our medical teams. So that's basically how we handle the patients inside the hospital. Now I'm going to show you about the tests. So next slide, please. For the test, actually, you have primarily two tests. The first one is PCR, which is actually still the gold standard. So if you don't know whether you have COVID and you want to get tested, you need to ask for that test. PCR stands for polymerase chain reaction. So it's basically looking for whether or not the virus is present in your organism. So we will do a swab and get some respiratory specimens, and then we will send it to the lab. And then it takes about 2 days for you to get the results back. Now you're gonna hear a lot about rapid test, blood test, serological tests. These are all the same. It's basically a blood test and we can get the results within 30 minutes. However, it cannot tell you whether the virus is present, but it's looking for antibodies. So your immune system, if you have a virus, will produce those antibodies. And basically, if you have a high antibodies count, then we know that the virus is present. And depending on your symptoms, we can assume that you have COVID. So, but it takes time for your body to produce, for your immune system to produce those antibodies. So you cannot do the blood test at the early stages of the disease. So that's why I'm telling you that the PCR test is the one that you want to have. The rapid test, the blood tests are not currently available at Samitivet and other hospitals, I think, but they will be in the coming days. So they've been approved, and the labs are gearing up for it. And sharing the protocols with the other ones. So PCR is the one you want to do, and serological tests will be coming later. And I've seen there are a lot of questions about the reported death cases and the figures, are they accurate or not? I think the rapid blood test can help with that, because a patient that will pass away and hasn't been tested, you can still do the blood test and look for antibodies after the patient passes away. So that way we can actually link it to COVID or not. Next slide. So, and this is the facilities, how it looks like. So on the left side of the screen, you see all those stands that I was talking about. They are on the parking lot outside, and you can see actually that the doctors and the nurses that will go into those stands have heavy equipment, protective gear to reduce the risk on the medical personnel, the healthcare personnel. And then on the right, so these are for the asymptomatic patients. It's basically a drive-through. So you just go into the garage, and then you don't leave your car. We do the swab, and then 24 hours later, we will contact you with the test results. Next slide. So this is a standard ward. Actually, I'm cheating a little bit with this one. This is not the ward that we closed for the cohort wards, but the rooms will look very similar to it. So like Jean-Charles said, you know, if this happens to you, bring a lot of books because you're gonna be in that ward for some times. And then next slide. The thing where maybe Samitivet is a little bit different actually is the virtual hospital. So over the past few months, we've seen the number of patients going to hospitals decreasing, and it's all but understandable that you don't want to go to a case where you might see COVID patients. So virtual hospital teleconsultation is actually a good way to keep in touch with your doctor without physically going to the hospital facility. So there are 2 hospitals in Thailand which have virtual telemedicine. One is Bumrungrad and one is Samitivet. So on the top is how you connect. So you can connect either via our Samitivet Plus app, via Line, or just go to samitivethospitals.com, and on the browser you can connect to the virtual hospital. It will take you to a screen where you need to register. The registration is a bit tricky because you need to give your ID card. But once you pass that, you will talk to a nurse, and that nurse will screen you, ask you a few questions to direct you to the right doctor. And then that doctor, you have about 15 minutes consultation with that doctor to talk about your issues. And then, you know, like there is an online platform for online payment. The price for 15 minutes is 500 baht, which is much cheaper than what you would pay in the hospital. And there's also drug delivery. So if you live in Bangkok, we can deliver the drug at your home, and it's also cheaper than if you go to the hospital. But one of the critique that is leveled at virtual hospitals or teleconsultation is that the doctor doesn't have a lot of information to work with because he doesn't have the vital signs. He just goes from what the patient is describing via a Zoom meeting, basically. So now actually we are also having devices available that the patients or even companies or schools can purchase and have. And with that device, you can actually take your vital signs. So you can take your pulse, you can take your blood pressure, you can take your temperature. You can actually have a camera on the device, so you can have like a ear, nose, and throat visuals. You can even like show lesions on your skins, and that integrates with our platform. So the doctor from the virtual hospital will get all those readings and will be able to make a more accurate diagnosis. So this has been something that's been very successful because, as I mentioned earlier, people don't want to go to hospitals. So this is another way to stay in touch with your doctor if you have medical concerns. So that's it for my presentation.
Okay, thank you very much, Nicolas, for sharing
Thank you, Vic.
experience on the hospital side. think we have a few questions here. A question from one of our participants is concerning Simitived in Yangon. So does Simitived in Yangon practice the same policy, and do they have the same capacity for treatment?
So in Yangon, we actually have two clinics. So they are not fully fledged hospitals. So one clinic inside Parami Hospital has been closed because we had some tourists who came with COVID. And so we had to close the clinic. But the second clinic is a standalone clinic and is still open. So we've set up the same ARI clinic outside with the tent for the screenings. And we have all the PPE and same guideline as in Thailand in that clinic. However, there is no ward in that clinic, so we have to refer you out. But we can do the testing, but we cannot keep the patients in-house, so we need to refer to another hospital.
Okay, thank you, Nicolas. And another question, I think we have time for one more question, is do you have any specific process for children?
For children, well, actually, that's a very good question. So for the children, one of the parents can stay with the child if that child needs to be admitted. Actually, thankfully, we haven't had that case right now. So we have had 0 pediatric COVID cases at Simitived.
Okay, thank you, Nicolas. Any remaining questions, we'll ask you again at the end of the webinar. Thank you. And now I'd like to pass on the floor to Guillaume, who will talk a bit about health insurance coverage of COVID-19 for a few minutes. Please, Guillaume, you may start.
Thank you very much, Vic. Thank you, Gérard. Thank you, Jean-Charles and Nicolas for your presentation. I will speak about health insurance coverage. Is maybe not the most attracting subject for this presentation, but it's actually one important subject we should discuss about also. So let's first start with a question. Can we go to the next slide, please? I want to ask a question to actually all the attendees of this webinar. Can we send the question to everyone, please? So it's the question, and it will be really grateful if you can answer, is have you ever read carefully the term and condition of your insurance policy? It's maybe, you can think it's maybe a stupid question, but it's actually very, very important. We will see after a while. So maybe let's give 30 seconds to the attendees to reply to this question. Do we have the results? So, okay. So we can see that actually 73% of the attendees already read the term and condition of your contract. I want to say thank you to all those attendees that are reading carefully the term and condition and understanding really in a good way, let's say, the product that I'm showing you. But currently, we still have 28% of the attendees who didn't read carefully the term and condition. And why it's important to read the term and condition? Can we go on the next slide, please? So, okay, it's important to read the term and condition of your insurance policy, especially today, because as you may know, in the general term and condition of your insurance policy are written the specific exclusion that applies to your health insurance policy. Why I'm speaking about exclusion and why during this period is because since the World Health Organization has confirmed that COVID-19 is a pandemic in the world, a lot of health insurance contracts will no longer cover COVID-19 because basically pandemic are excluded inside specific products. So it's really important that everyone currently is reading carefully the term and condition of their health insurance policy to understand if there is a specific exclusion linked to COVID-19. I give 2 tips to understand, to help the attendees to review and understand if such exclusion is present in the term and condition. The first one is really simple, to review and read again the general exclusion of your policy inside your policy wording or term and condition. And let's say if you are under a corporate policy, just request to your HR to contact the insurer and ask for a confirmation letter confirming that if COVID-19 is covered or not. So at least you are 100% aligned with which diseases are covered under your health insurance policy. Let's move to the next slide, please. So now that we saw that it's important to read your term and condition, what products are present in Thailand? So those slides will be really focused on the Thai market. I know that there is people also outside from Thailand. Maybe we can do another webinar in the future regarding the other markets in Southeast Asia. But currently, it will be focusing on Thailand. So currently, we have 3 different types of products in Thailand. The first one is the specialized COVID-19 product, as you may find, for example, insured like Dipaya. So those products are very specific to COVID-19. It only covers costs related to COVID-19. I put some example regarding the possible coverage that you can find for those specific products. So for example, the first coverage can be coverage for critical illness stage of COVID-19, so up to 1 million Thai baht. And another one, coverage of hospital expenses due to COVID-19 up to 100,000 Thai baht. So just for your idea, the pricing, the premium for those type of insurance start around 450 Thai baht per year and per person. The second product that we found, and those products were really successful at the beginning of the crisis, it was the lump sum payment COVID-19 product. For your information, most of the insurers stopped to sell this product already since 3 weeks, I think, 3 weeks, around 1 month. So I will not lose time anymore to go on this, and I will move to the other one. Can we go to the next slide, please? So then another type of health insurance product that you can find is a comprehensive health insurance product or an international health insurance product. What are the advantages of those products is, first of all, a more comprehensive coverage for the top international hospital and local hospital also. So compared to the specified COVID-19 product that you can have, those insurance policy really cover a wider scope of disease. Also, you can find additional services such as 24/7 multi-language, cashless hospital, second medical opinion, which is, I think, really important currently. And as I said, coronavirus and other disease coverage, not only coronavirus coverage, but also other disease. So it's another type of product that you can find. Can we go on the next slide, please? So one last question to the attendees, just to understand basically on which type of product insurance you currently covered. So you will have also a question. Can we send it to everyone, please? And just answer it. We will see the results. Yeah, we have the results or not. Okay, so the majority of the attendees, which is actually good, are covered for under comprehensive health insurance coverage. 2% have a specified medical bill coverage COVID-19, over not, and 7% still not insured. So I will try to give you some arguments to push you or help you to decide which type of product is built for your needs. Can we go on the last slide, please? So for your information, so one question, what type of product should I choose and when should I buy it? Just to help you a little bit, and I will go very quickly, Vic, it's my last slide. So the first product, specified COVID-19 product, as we saw at the beginning, the first one really specific to the COVID-19, we consider this product as a short-term solution. Why short-term solution? Because it only covers COVID-19. You will not be covered for other disease than COVID-19. So let's say if you buy this insurance, but let's say in 1 year, you unfortunately, you just attract another disease, this specific product will not cover it. The comprehensive health insurance, and I'm really happy to see that the majority of the attendees are currently covered under this type of product, are considered as long-term solution. So it's linked to what I said before, long-term solution, because it covers a wider scope of disease. It will support you to cover your disease, and also in the long term, you will be able to renew it years and years and years. Than, for example, the specific COVID-19 product, you will only keep it for 1 year because currently, let's say the pandemic will, and I hope will not last 2, 3, 4 years. So one argument that I want to say is only that save money by anticipating the purchase of comprehensive health insurance that best suits your needs. Why? It's because if you wait to be sick and to buy a health insurance, then the private health insurer, as you know, will apply some exclusion linked to your pre-existing condition. So you will save money by purchasing a comprehensive health insurance, let's say when you are young, when you have not so many pre-existing conditions, and this comprehensive health insurance will cover you along the year with a wider scope, with including so the pre-existing condition that, for example, you may not have at this younger age and in the future. So it's really important to understand that if you are waiting, you will need maybe to face some pre-existing condition added to your policy and some exclusion. So I will just finish with one slide with additional information. Can we move to the other one, please?
And Guillaume, we have to wrap up.
Yeah. Can we just go to the next one? It's just additional information for everyone. Yeah, so I'm finishing on this. So additional information, I saw one question from Monica Novasic, sorry if I'm not speaking well, who was asking to give more information regarding the specific hospital or product available in the countries outside of Thailand. So you will be able to find some information regarding COVID-19 product or hospital in Cambodia, in Vietnam, in Myanmar, if you go to the second link, and also some information regarding the COVID-19 product on the first link. So feel free to go on those blogs and just catch some additional information. It will be really useful for you. Thank you very much.
Thank you very much, Guillaume. That was a very interesting introduction to health insurance. Hope everyone has good takeaways from that. So now we're approaching our Q&A, and I think we have quite a lot of questions. So thanks everyone for staying with us this long and sending over the questions. We'll start by the following questions. So the first question will be for Dr. Gerard, which is, which country is handling the crisis better and why? Dr. Gerard. Please unmute yourself, please. Please unmute yourself, Dr. Gerard.
Okay, can you hear me? Yes, okay. The question is, which country handled better the crisis?
Correct. And why?
I think I will not have any hesitation to say South Korea. They have shown how a modern approach to outbreaks like this should be done. They have been starting by massive testing, which allows to diagnose immediately the positive case, which means early diagnosis means early treatment, and of course, isolation, selected isolation of positive cases, while those who are negative can still go to work. So they have been able to control the outbreak, even though they had a big issue with the church group, the religious group, which was bringing so many cases, but they have been able to manage this. Are also very quick in identifying the contact people who might have contracted the disease. They introduce also the tracing element, which may pose some questions on the privacy, but at least in this kind of outbreak, I think it was justified. And as a result, they controlled the outbreak and the economy was still performing. I talked to a friend of mine living in South Korea. The export of South Korea in March 2020 were at the same level of March 2019. So I think a lot of countries have to look at what Korea has done. Of course, not only Korea, I think Taiwan has done also an outstanding job, and other countries probably. But to me, South Korea really deserve a praise on the way they have handled the epidemics.
Okay, great. And when do you think the vaccine will be out?
Okay, that's a bit more difficult question. When you prepare a vaccine against a viral disease, you have to make sure that the vaccine will be not only effective, but also safe. And safe is very important. I will take a parallel with the development of the dengue vaccine. The dengue vaccine was a long work by Sanofi, about 20 years, and they come up with a vaccine. The name was Dengvaxia, which was initially released with studies of 1 year follow-up. In a 1 year follow-up, in a group receiving vaccine as compared with those who did not receive vaccine, there were a better protection among the group who got the vaccination. But there were already some signs that some of the people who got vaccinated had also some kind of severe dengue as well. So the regulators asked the company to prolong the follow-up period. And what happened after 3 years follow-up? The curve changed, meaning to say those who had been vaccinated were experiencing more severe dengue. I repeat, those who were vaccinated had a more severe dengue episode. And that is due to what we call now the facilitating antibodies. A vaccine is supposed to produce protective antibodies, which we call neutralizing antibodies, to block the virus from entering the different cells in the organism. But unfortunately, while they produce protective antibodies, they also produce facilitating antibodies, which aggravate the disease. And the point which is very important here, it took 3 years for Sanofi to demonstrate that this problem happened in the long term, not in the short term. So my opinion about the vaccine, if a vaccine is available before 2023, we don't know the safety. And of course, 2023, hopefully, this SARS-CoV-2 will be hopefully away from our memories, not totally, but at least partly. And the concern will be something else in terms of curative treatment or prevention treatment. So vaccine is good, but takes really a long time to develop because of these facilitating antibodies, which have been demonstrated in the SARS 2003 tentative of vaccine, as well as Ebola, and as well as most likely other viral disease, including flu, in fact. So be careful about a vaccine that will be released in, let's say, in 2020. That will not be a safe vaccine. I mean, the demonstration of safety will not be demonstrated.
Thank you, Gerard. Another question from a participant is, do you think there could be a second or third wave of COVID-19 outbreak after the release of confinement measures?
I've seen a lot of papers on that, and journalists, especially those from the sensational news, they are predicting a lot of things. It's interesting to know also that just a few weeks ago, a few months ago, some people were predicting that 2 to 3% of the world population may die from COVID-19. 2 to 3% of 7.4 billion, which means about 185 million people should be dead. Now we are at 150,000 or 160,000 dead. We are very far from these figures. It's still very high, but very far from this totally wrong prediction. So second wave. You have seen the curve, which I show around the world. and also from some experts from the south of France, which are really one of the world opinion leaders in the field of epidemiology and infectious diseases. All seems to show that in all countries, the curve shows a typical exponential growth curve, which goes down after reaching the plateau. It looks really like a seasonal type of viral respiratory disease. And of course, it might have some cluster which can still happen. But second wave and third wave, I think it's a way to again create psychosis among the people and also creating a lot of fears to release the confinement. I'd like to say something if I still have time here. We are always talking about acute disease. COVID-19 is an infectious acute disease, and that is scary because people do not know what is it, and because it is acute, it is scary. But what we know, because of the recession which is now happening because of all these lockdowns throughout the world, this recession will induce a lot of chronic disease. And chronic disease which already exist or which will be more severe due to the recession because of the unemployment, because of all disorders which can happen. And here we are going to see a very high spike of cardiovascular problems, especially heart attack. We are going to see a lot of mental health disorders and problems, including suicide, which is always following recession, and big depression happen also. And also cancers, which happen also because of the strong influence of high and unprecedented stress like what is happening now. So in other words, we should now let the infectious disease specialists to take some rest. I'm joking, huh? And let the cardiologists, oncologists, and especially psychiatrists to explain also what they are going to face if we don't let the people go back to a normal life. Of course, with some precaution, we have to do step by step, progressive, removing of the confinement and lockdowns. Of course, it has to be logical with good measures. We have to keep wearing a mask. We have to keep the barrier gestures, checking temperature. That's fine. But let the people go back to normal life.
Thank you, Gerard. Okay, that was a good question. I have another question from our participant, 2-3 more questions for you, Dr. Gerard. One is how many days it would take to the stage of spreading virus from the time that you get infected, right? And after you are negative, can you still spread the virus?
When you are tested negative, which means the PCR test, which is quite sensitive, the new one, not the old one, but the new one, which means very sensitive, which means they will let few false negative. It means you have a viral load which is very low. So I cannot say that nobody with negative testing cannot shed some virus and maybe contaminate someone else. In medicine, it's never 100%, it's never black and white. But the likelihood that when you turn negative, that you can still infect people, I think is extremely low.
Okay, thank you. And another question is, how does HQC help? I assume that's the name of a drug that maybe you...
Hydroxychloroquine is...
sorry, just to finish the question, how does it help? What does it do? And yes, so what do you think about that drug?
Because I saw the question here also. Hydroxychloroquine is an anti-malarial agent which is used for curative and prophylaxis treatment of malaria, paludism in French. This product has been used for over 50 years. The safety profile of this product is known very well. And for a short period of administration, in the case here, they give about 10 days treatment. It is practically no side effects. Of course, you have to, because it is a medicine, you have to do some tests. For some people who have heart problems, you have to do an EKG. You may have to do some dosage of the potassium in the blood for some cases. But in general, this product is highly safe. It has a specific antiviral properties on top of being also anti-malarial. It is also very much used nowadays for rheumatism disease like rheumatoid polyarthritis and lupus. So that's why you have a long experience in safety of this product. Actually, the safety concern happened after more than 2 or 3 years of usage. So if you use it for 10 days, it's close to zero problem in terms of safety. And it has been demonstrated to have a specific antiviral effect in vitro, which means in the tube, in the laboratory. And the Chinese experience reported some benefits of this agent to limit the number of people who get more severe type of COVID-19. So less people were sent to ICU. It has been used also in south of France, in the largest institute of infectious disease, with apparently very good result as well. I know there is a controversy about the full proof of this medicine. But during crises like this, you don't have so much time to do all these perfect world type of studies. You have to do it quickly, because especially if it's already over by June, so you need to treat these people who are affected in February, March, April. If you just wait for the perfect study, double-blind trial, and so on, the time you get the result, epidemic's already over. So these people have been using hydroxychloroquine, especially with antibiotics. It's very important. It's very important. Why? Because we know that viruses have kind of teamwork with bacteria. The virus induces damage on the cells, especially on the lung. Then the bacteria can come in, damage further, which helps also the virus to continue. It's a vicious cycle. So the virus helps bacteria and vice versa. So that's why it's very important to use also antibiotic.
Okay. Thank you, Gerard. Thank you for that answer. Now I have a question for Jean-Charles. When you were admitted, were you given a choice to receive treatment or not? Because treatments were not yet fully validated.
When I got admitted, yes, the treatment started right away. So, I mean, it's good that the question asked, because as a patient, of course, the explanations, I would say, on the treatment has been quite limited. Knowing the crisis and the fact that this disease is unknown to people, you need to, I mean, take your chances and trust the doctors, because it's not something that you're going to read a lot of proven facts on internet, or it's between people who are pros and cons on everything. I wouldn't say that it's the cure 100%, but that's the best cure which is available at the moment. And I think that was the best risk I had to take to choose the treatment and to follow it, even if my information and knowledge on the drugs is limited. And luckily it worked. So I think that's something that you must be ready. I didn't feel any second effects. I think it was mentioned by the doctor, but the worst effect you will get is from the beliefs, from your mood, from what you read online, from the fact of not walking too much, also not doing exercise. It's more these kind of things which affect you rather than the treatment by itself, which I think overall didn't give me too much complications.
Okay, great. That's good news. Thanks, Jean-Jacques, for the answer. The next one would be for Nicolas. If a patient recovers from the virus, what would the medical certificate say? Would it say positive or negative? And if it's positive, could you use that to get on a plane? Oh, sorry. How can you get on a plane?
Yeah, we can issue fit to fly certificate. So the last part of the question I can answer with absolute certainty. So we would issue medical certificate with the clearance of the virus and the fit to fly certificate. So that's no problem. The first part of the questions was about if it says positive or negative, right?
The first part of the question, yes. If it's positive or negative, what would it say on the medical certificate? And so if you recover, what it would say on the medical certificate? And if it's positive, how you can get on a plane.
I don't know the exact wording, but it would say clear of the virus, and then we would issue the fit to fly certificate.
Okay.
Sorry, it's not very specific.
Okay, I think that answers it. Great, thank you, Nicolas. Okay, I have another question now. It's for, I think, more for Dr. Gerard. Is it true that the amount of initial exposure to COVID is crucial to how sick you get?
This is true for any viral disease. If you get a very high viral load, you are likely to get more serious disease. But again, we see that this disease is basically very serious for people above 70 years old. I could not remember exactly the figures I computed last time. That's about close to 84% of people who died from the COVID-19 were above 70 years old. And there were very limited 1.1% of the people below 50. That's our experience in Italy, who also died from the disease. So it means, sure, but by logic, the more virus you get, the more intense disease you can get. But the background of the patient, I mean the person, how strong he is to fight against the virus introduction, the immune system, the absence of comorbidities, and so on, is also playing a big factor here.
Thank you, Gerard.
Mm-hmm.
I think we're approaching our webinar. Sorry to the other questions that we don't have time to respond, but we'll be sure to maybe respond on other channels and get the answers to you. So feel free to kind of contact us privately, and any one of us, I think, will be more than happy to answer your questions. Again, thank you all participants and all the speakers for really sparing your time. Jean-Charles, thank you so much. I'm so glad that you recovered. Thank you, Nicolas, as well, for sharing your experience and your time with us. Of course, thank you, Dr. Gerard, as well, and to all the participants. Thank you, and we hope to see you soon again for our next webinar. And if you have any comments about this webinar, please feel free to leave us a message and let us know how we can improve, or is there any other topics you want to know about or discuss about, please do let us know. Thank you and have a good night. Bye-bye.
Thank you. Fini?